takes me forever to find the button, no matter how many times I push the record button. I like every time I'm like, where is that? Or like screen share. But anyways, hello, Trent.
Hello, everyone. Welcome back to the Progressive Rehab and Strength podcast. We are here. I'm Dr.
We are.
We are here. Who am I? Who are
You're
you?
there.
I'm there. You're
I'm
here. Whatever. All right. Well, welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rory Alter, clinical coach here at Progressive Rehab and Strength, with my lovely co-host, as usual, Dr. Alyssa Havison, also a clinical coach here at Progressive Rehab and Strength. And in this 10-minute tip, we are going to try and very quickly give you the rundown of figuring out your stance, your position, and things that might be contributing to your hip pain in the squat, and then some variations, like if you can't figure it out with stance and execution adjustments, some variations that can help you continue to train the squat without hip pain. This is a very near and dear topic to my heart. I don't know where this episode is falling in the order of events here, but this is coming in hip month, so it's coming. Oh, it's coming before my my story about my battle with hip injuries, or just the battle with my hips, because I've got some interesting hips. So we'll talk about that in the next, I guess, Saturday episode after this one. But this is a near and dear topic to my heart. Super passionate about it, so I'm happy to be here in hip month with all of you, and I love treating the hip. I've managed to continue to train and all that good stuff over the last 13 years without having surgery, and all that stuff. So super passionate about it. But what we're going to do in this 10-minute tip is talk to you about continuing to squat with hip pain. So let me get my timer started. Timer. 10 minutes. All right, folks, here we go. 10 minutes on the clock, Alyssa. And, if we've already, ad nauseum throughout this podcast series or whatever, we've talked about load management when we've got injury. So we're already past, at this point, when we're talking about the things in this episode, we're already past, looking at lower loads, changing the frequency, that kind of stuff. So if you've kind of exhausted load management as an option and you're still having symptoms with your squat, or, we do have to tie in technique with load management. So first we're going to talk about kind of technical adjustments to the squat. So as a clinician and as a coach, what are some of the things that we're looking at in our assessment and our modification of the squat when someone is experiencing some type of hip pain? Doesn't matter where the hip pain is, because everyone's hip pain responds differently to the same type of thing. There's all different types of squat hip pain, and you can do the same thing and relieve someone's squat pain, and it doesn't relieve it with another person. So what do we do?
So there's a few main things, not the only things, but main things that we'll be considering. And that's going to be joint synchrony, stance, and foot position, which I'm using two different terms for a reason. So like toe out angle, and then like how wide your feet are,
right.
And then the bottom position. But let's talk about the first two first, because they're going to affect the bottom position of the squat. So when we talk about joint synchrony, we're really talking about keeping the joints in sync as they're moving. So with the squat, we want to see the hips and the knees bend at the same time as the squat begins. We want to see the knees track forward from the time they bend, and the hips move back at the same time.
Right. And at the same rate.
Yeah. At the same time, the same rate. So we don't want to see like hips bend and come back and then the knees unlock, because that's really going to affect the bottom position. It's going to affect the movement efficiency and being able to keep the bar moving in a straight line over the midfoot.
And even some people, if they are unlocking their knees and hips at the same time, like you mentioned, the knees have to travel forward. They'll unlock their knees, but then they won't let them travel forward. So first they'll like unlock their knees and hips at the same time, but their hips travel super far back, and then they move their knees forward. So we want to see this like kind of accordion action happen with the squat, where the knees and hips unlock at the same time, but also the knees move forward and the hips move back at the same rate, right from the start of the motion.
And big surprise, we want to see that look the same on the way up,
Exactly.
and as you lock out. So it really should look, assuming that we get it right on the way down, driving up should look similar.
Right.
And things should be happening at the same rate and at the same time. And knees and hips should be locking out and finishing the lift at the same time. Stance and toe out angle, that's another piece of this. So obviously, with hip pain, we want to make sure somebody's not squatting with their feet too wide, but or too narrow. And we were just discussing the fact that there isn't one right answer when we're dealing with this sort of trial and error process of somebody who has hip pain. Sometimes a narrower stance with more toes out can feel better for someone, and it really depends on them and me as well, actually. So and really but that's not the only answer. It's not like if you're having hip pain, you have to have a narrow stance with your toes really turned out. It's going to have a lot to do with you and what's going on with you and where your symptoms are coming from and how your anatomy is formed. And we don't have to know that specifically in order to find what works.
Yeah, I was just going to be like, you do not have to know your anatomy. You don't need like an x-ray or an orthopedic exam lying down on a table to figure out if your hips are retroverted or anteverted or like whatever. You don't need to know that. It's because, like I said, three people could have retroverted hips and they all have different stance because it feels different to them. Totally agree with that stance and this trial and error. I mean, it's not really trial and error for the joint synchrony thing. Like that is like you're doing it or you're not. Yeah. It might be trial and error on what cues work best for you, but for stance, it's really going to be trial and error. The other thing that I wanted to bring in, you talked about the joint synchrony and the timing of everything influencing bar path. So if we get this like forward bar path, a lot of people can get pinching of their hips at the bottom of the squat when their bar travels forward. You get kind of more slamming into the hips. And then the other thing is also looking at depth. So if you are going too low, that can irritate your hips. And then the other thing that sometimes irritates the anterior hip for a lot of people is on the way up, and this goes back to joint synchrony and this kind of accordion process. If you're getting to the sticking point and you're lifting your chest much faster than you're extending your hips and knees, and you're kind of pushing your hips forward and sliding into your knees, it kind of recruits your quads and your rectus femoris more than it needs to be in that period of time, and they're always recruited. We're not recruiting them. They're not like shut off and it turns them on. You're just recruiting them in a different pattern, and it can irritate the hip flexors. So all these things, like when we're assessing the squat, we want to look at all these things. It's a lot to look at, and the more squats you look at, the more squats you execute, the more hips you work with, the more hip pain you work with, the more you'll kind of see, you'll be able to kind of look at things and it won't be this like, well, what am I looking at now? It'll just be like, oh, okay, this is what I see happening, and this is probably why or what we need to do next. In terms of, so like, let's say we've made all those adjustments and the person is experiencing hip pain in the bottom of the squat. So like pinching or an ache or whatnot. What type of substitutions can we use for bottom position symptoms?
So a couple things, and actually we discussed one option, but we don't necessarily need to go right to like a box squat and limiting that range. We can try like a higher bar. We can try different, and that might not always be the answer. But again, I think that this trial and error process is really important because there isn't one right answer. So just like finding the foot position that works, finding a bar position or bottom position, and the bar position is going to also affect the bottom position, but we also want to make sure that the bottom position is optimal where they are at their starting point, and then assess that and see if we need to change anything. So, and then if we need to, and if this person really is like not feeling good below parallel, that's when we can start to look at like a box squat, reducing the range of motion, assuming that these are symptoms that are present regardless of the weight on the bar. So even just the bar and very lightweight, they are having symptoms. If we don't need to go into the load management
Right.
part
No
again.
load management anymore. We've done that already. This is after load management. Yeah, I think one thing that I would also say, kind of to help with identifying all of those issues or technical concerns that might be contributing to symptoms, we might want to slow the lift down. So tempo squats or pause squats, especially someone if they're having difficulty in the bottom position and they're having difficulty controlling the bottom position, or that ballistic motion. So we do utilize the stretch reflex at the bottom of the squat, and sometimes the bouncing, even if their position is good and they're not getting knee slide, they're not getting knee cave, they're not going too low, that bounce can just be a little irritating to the hip if your hip is inflamed. So doing a pause squat or a tempo squat, because the tempo, even if you're not pausing, the tempo almost forces you to slow down. And then if the person's still having trouble slowing down, you can add that pause in, because that will slow them down even more going into the hole. And that can, allow you to continue to squat without symptoms. And then we would move into the box squat above where you're experiencing the symptoms. And I think that I don't know when this episode comes out relative to the episode we're doing with John, but we're doing an episode, a 10-minute tip episode with John on how back angle affects the hip, how bar position and back angle affect the hip in the squat. So that after we've done the tempo, pause, and box, kind of does this work or not? And if someone's still having symptoms with the box squat, then we can change the angle of the squat as well. So that might be a high bar or a front squat. Some people, this is not everyone, but a lot of people with impingement type symptoms do better with a more open hip angle. So we'll talk about that in that 10-minute tip episode. So they do better with a high bar or front squat. However, that doesn't work for everyone. I have femoroacetabular impingement, doesn't work for me. I have to low bar. The other two lifts feel worse on my hips. So that's kind of the progression we would take. A lot of people do feel symptom relief with their belts on, even at lightweight. Or we're at the timer's up. We're at 10 minutes. They do feel symptom relief with their belt on at lightweight, because the increased intra-abdominal pressure stabilizes the spine a little bit more. Some of the hip flexors attach to the lumbar spine. So that increased intra-abdominal pressure and belt use can help relieve some of the symptoms in their hip. And also, when we have the belt on, we have better abdominal activation and recruitment of the core musculature, which allows us to just utilize all of our muscles a little bit better. And when we use our muscles a little bit better, sometimes things feel better. So belt can, and also just having a little bit more fluff. I know that the belt isn't fluffy, but just having more mass in your abdominal region can also help kind of with proprioception in the bottom of the squat. So and this, I'm just kind of ranting here and kind of going down a little bit of a rabbit hole, but as a belt or even knee sleeves, like if you don't train with knee sleeves, having increased proprioception at your knee and or in your core can help execute the lift a little bit better, which takes pressure off of your hips. So sometimes if a person doesn't use knee sleeves and isn't using their belt on all their squat sets, I would say, we can try adding those in and see if it helps. For me, I know that my symptoms are less when I do have knee sleeves on, and, just sitting here now, I'm kind of thinking like, I haven't been training in knee sleeves. Maybe I should start putting them back on. But I think those are, it's a trial and error. Like you said, Alyssa, everything is always a trial and error. And there's a lot of things that you can look for and a lot of things that you can do to keep squatting, even if you have a hip injury or hip pain. So we just want to encourage you guys to find what works so that you can train with less symptoms or no symptoms, and not give up on training altogether and not lose your progress. So if you have any questions, you can, shoot us a message. You can join us in the free Facebook group, The Secret Society of Barbell Mastery. You can submit a podcast request form using the link in the show notes. You can book a free consultation call with any one of the clinical coaches here at Progressive Rehab and Strength. And if you are having hip pain, we hope you feel better soon. And if you're a clinician or coach, we hope that this episode helps you. Thank you all, and we'll see you next time. Bye for now.